Introduction. Schizophrenia is a complex and chronic mental disorder that affects approximately 1% of the global population. It is characterized by a disconnection from reality, including symptoms such as hallucinations, delusions, disorganized thinking and speech, and impaired social functioning. The exact etiology of schizophrenia remains unclear, but research has provided significant insights into the underlying pathophysiology, neurochemical abnormalities, genetic factors, structural and functional brain changes, and the role of neuroinflammation in its development. In addition, this script will explore the pharmacological and psychological treatment options, cognitive deficits, positive and negative symptoms, differentiation from other psychotic disorders, comorbidities and medical complications, as well as the prognosis and long-term outcomes in patients with schizophrenia. Schizophrenia is believed to arise from a complex interplay of genetic, environmental, and neurodevelopmental factors. Studies have shown abnormalities in several brain regions and neural circuits, including the prefrontal cortex, hippocampus, and striatum. Neurotransmitter dysregulation, especially involving dopamine, glutamate, and serotonin, plays a crucial role in the pathophysiology of schizophrenia. Excess dopamine activity in the mesolimbic pathway is associated with positive symptoms, while reduced dopamine activity in the mesocortical pathway contributes to negative symptoms and cognitive impairments. Other neurotransmitter systems, such as glutamate and serotonin, are also implicated in the disease process. Dysregulation of neurotransmitters, particularly dopamine, glutamate, and serotonin, is a hallmark of schizophrenia. Dopaminergic hyperactivity within the mesolimbic pathway is thought to underlie positive symptoms, such as hallucinations and delusions. Antipsychotic medications primarily target dopamine receptors to alleviate these symptoms. Conversely, hypofunction of the mesocortical dopamine pathway contributes to negative symptoms and cognitive deficits in schizophrenia. Glutamate, the major excitatory neurotransmitter in the brain, is also implicated in the pathophysiology of schizophrenia, particularly in relation to the N-methyl-D-aspartate, NMDA, receptor hypofunction hypothesis. Serotonin abnormalities have also been implicated in the cognitive impairments seen in schizophrenia. The heritability of schizophrenia is estimated to be around 80%, highlighting the strong genetic component of this disorder. Despite the high heritability, a specific gene or set of genes responsible for schizophrenia has not been identified. Rather, multiple genes of small individual effects, interacting with environmental factors, contribute to the development of the disorder. Various candidate genes have been implicated, including those involved in dopaminergic and glutamatergic pathways, synaptic plasticity, and neurodevelopmental pathways. Additionally, chromosomal abnormalities and copy number variations have also been associated with an increased risk of schizophrenia. Neuroimaging studies have consistently demonstrated structural and functional abnormalities in the brains of individuals with schizophrenia. Structural imaging techniques, such as magnetic resonance imaging, MRI, have revealed reduced gray matter volume, especially in the prefrontal and temporal cortices, hippocampus, and thalamus. Ventricular enlargement and abnormal white matter tracts are also observed. Functional imaging studies, such as functional MRI, fMRI, and positron emission tomography, PET, have revealed altered activation patterns and connectivity within and between brain regions, particularly in the default mode network and frontostriatal circuits, contributing to the cognitive and affective symptoms of schizophrenia. Emerging evidence suggests that neuroinflammation may play a role in the development and progression of schizophrenia. Activation of microglia, the brain's immune cells, and increased levels of pro-inflammatory cytokines have been observed in individuals with schizophrenia. This neuroinflammatory response may contribute to neuronal damage, impaired synaptic connectivity, and altered neurotransmitter regulation. Environmental factors, such as prenatal infections and immune dysfunction, have been implicated in triggering the neuroinflammatory response and increasing the risk of developing schizophrenia. Pharmacological treatment is a cornerstone in the management of schizophrenia. Antipsychotic medications, such as typical and atypical antipsychotics, target dopamine receptors to alleviate positive symptoms. Typical antipsychotics primarily block dopamine D2 receptors, while atypical antipsychotics target both dopamine and serotonin receptors. However, these medications may have side effects, such as extrapyramidal symptoms and metabolic disturbances. Clozapine, an atypical antipsychotic, is reserved for treatment-resistant cases due to its superior efficacy but potential for agranulocytosis. Adjunctive medications, such as mood stabilizers and antidepressants, may be used to address comorbid conditions and improve overall outcomes. In addition to pharmacological treatment, psychological and psychosocial interventions are essential components in the comprehensive management of schizophrenia. Cognitive behavioral therapy, CBT, has been shown to be effective in reducing positive symptoms, improving insight, and enhancing functional outcomes. Family interventions emphasize psychoeducation, communication training, and problem-solving skills to reduce relapse rates and improve family support. Social skills training, vocational rehabilitation, and supported employment programs aim to enhance social and occupational functioning. Case management and assertive community treatment provide ongoing support and coordination of care for individuals with complex needs. Cognitive deficits are a core feature of schizophrenia and have a significant impact on functional outcomes. These deficits encompass multiple domains, including attention, memory, executive function, and social cognition. Neuroimaging studies have revealed disrupted connectivity and abnormal activation patterns within brain networks associated with these cognitive functions. Pharmacological interventions, such as cognitive enhancing agents, and psychosocial interventions, such as cognitive remediation therapy, aim to ameliorate cognitive impairments and improve overall functioning. Schizophrenia is characterized by a wide range of symptoms, including positive and negative symptoms. Positive symptoms involve the presence of abnormal experiences, such as hallucinations, delusions, disorganized thinking, and grossly disorganized or catatonic behavior. Negative symptoms, on the other hand, involve deficits in emotional expression, motivation, social engagement, and speech. Both types of symptoms can significantly impair social and occupational functioning, but they respond differently to treatment approaches. Accurate diagnosis and differentiation of schizophrenia from other psychotic disorders are crucial for appropriate treatment interventions. Differential diagnosis may involve distinguishing schizophrenia from disorders such as bipolar disorder with psychotic features, schizoaffective disorder, schizophreniform disorder, and substance-induced psychosis. The duration and pattern of symptoms, associated mood symptoms, and functional impairment guide the diagnostic process. Thorough clinical assessment, including psychiatric interviews, symptom rating scales, and collateral information, helps in making an accurate differential diagnosis. Individuals with schizophrenia have a higher prevalence of comorbid medical and psychiatric conditions compared to the general population. Common comorbidities include substance use disorders, depression, anxiety disorders, metabolic syndrome, cardiovascular diseases, and respiratory disorders. Contributing factors include lifestyle factors, side effects of medications, and shared underlying pathological processes. The management of these comorbidities is essential to improve overall health outcomes and enhance the quality of life for individuals with schizophrenia. Schizophrenia is typically a chronic and relapsing disorder, characterized by periods of remission and exacerbation. Long-term outcomes vary among individuals, with some achieving substantial recovery and others experiencing ongoing disability. Factors influencing prognosis include the early age of onset, duration of untreated psychosis, premorbid functioning, adherence to medication and treatment, social support, and the presence of comorbidities. Early intervention, comprehensive treatment, and a holistic approach involving medication, therapy, social support, and rehabilitation services are essential in improving long-term outcomes in patients with schizophrenia. Schizophrenia is a complex mental disorder that involves multiple factors and mechanisms. The pathophysiology of schizophrenia involves neurotransmitter abnormalities, genetic factors, structural and functional brain changes, as well as neuroinflammation. Treatment options include pharmacological interventions, psychological and psychosocial interventions, and cognitive rehabilitation. Differentiating schizophrenia from other psychotic disorders is crucial for appropriate management. Comorbidities and medical complications associated with schizophrenia require comprehensive care. The prognosis and long-term outcomes in patients with schizophrenia are influenced by various factors, highlighting the importance of early intervention and holistic treatment approaches. Continued research efforts and advancements in understanding the underlying mechanisms hold promise for improving the outcomes in individuals with this challenging disorder.